Hello, Assalamualaikum everyone. Today I would like to introduce open total abdominal hysterectomy or TAH. This is a surgical procedure where the uterus and cervix are removed through an incision made in the abdomen. Is it usually performed for women who are experiencing ongoing health problems that affect their daily life? Doctors commonly recommend this surgery for conditions such as uterine fibroid, certain cancer and uterine prolapse, and other related gynecological conditions. Before the surgery, the healthcare team carries out several important checks to ensure patient safety, such as confirming the patient identity, making sure the consent form has been signed, and double-checking the correct procedure and surgical site. The patient is also prepared physically before surgery through fasting, which is also known as MTO, and having an IV line insert. TAH is one of the most commonly performed gynecological surgeries, especially among women aged 40 and 16 years old. So let's be brought to you the detail of TAH.
Let's talk about physiological preparation. We will assess and stabilize any chronic conditions such as hypertension and diabetes mellitus to ensure the patient is in optimal condition before surgery. We will also perform routine laboratory investigations such as complete blood count known as CBC and renal function tests to evaluate the patient overall health status. In addition, we will conduct a nutritional assessment and review the patient medication, especially anticoagulant or drugs that may affect bleeding. The patient will receive prophylactic probiotic as prescribed to prevent infection, and bowel preparation will be carried out if required. Next is physical preparation. For physical preparation, the patient will be instructed to maintain personal hygiene by bathing with antiseptic such as alcohol-hexidine to reduce the risk of infection. The abdominal surgical site will be cleaned and properly before the procedure. The patient is required to remove all the items including jewelry, dentures prior to surgery. Preoperative medication such as sedative and analgesics will be administered as ordered to promote comfort for the patient. Before transfer to the operating theatre, the patient will ask to empty the bladder before surgery. Okay, now next part is emotional and physiological preparation. For emotional and physiological preparation, will be provide a clear explanation about the surgical procedure and type of anesthesia that will be used in operating room. We will encourage the patient to express any fear and concerns such as pain or the outcome of surgery. Anxiety reduction technique, including deep breathing, exercises, relaxation, and pressures will be provided to help the patient feel calm. Family member will be involved to provide emotional support for the patient. Finally, informed consent will be obtained to ensure that the patient understands the risks and benefits of the surgery before the procedure is performed.
So now we are move on to planning of open total abdominal hysterectomy in planning of operating room. The operating room must be sterile, clean, and well organized to ensure the safe environment. The operating room table is positioned in the supine position to provide patient comfort and good surgical access. Lighting is properly adjusted to give a clear view of the surgical field. Surgical equipment such as suction machines and electrosurgical units are checked to ensure they are functioning properly. Anesthesia machines and monitoring devices, including ECG and pulse oximeter, are prepared and tested before the patient arrives. Next, planning of open total abdominal hysterectomy, preparation of instruments. A complete set of basic surgical instruments such as scalpels, scissors, forceps, and needle holder is prepared. Specialized instruments like injectors and anesthetic are also included to support the procedure. Instruments are arranged in order according to the flow of surgery for quick anti-patient use. All instruments are checked to ensure they are sterile, complete, and functioning properly. Backup instruments are kept ready in case of unexpected situation during the surgery.
Good day. Today I will explain patient position for an open total abdomen hysterectomy for this procedure. The patient can be placed in either supine or latotomy position. In supine position, the patient lay flat on her back with her body properly aligned. Her arms are placed comfortably at the side or on arm port to keep her safe during the surgery. In the lithotomy position, the patient is still on her back, but her hip and knees are bent, and her legs are supported in straight, but her buttocks are slightly at the edge of the table to give better access for the surgeon. It's also important to pad pressure point like a knee, calvin, and heel to prevent injury and keep the patient comfortably. Next, dripping for open total abdominal hysterectomy, a gyna drip is used to create a sterile cover the area from below the chest to the mid-thigh. This allows access to the abdomen and, if needed, the perineal area. Dripping is done after proper skin preparation and patient positioning. The sterile drip are placed carefully so that only the surgical area is exposed. Strict aseptic technique is maintained throughout to prevent contamination. Dripping also acts as a barrier against infection while helping to maintain the patient's dignity and privacy.
Moreover, the surgical safety checklist, which includes sign in, sign out, and sign out. During sign in, we confirm the patient identity, the correct surgical site, procedure, and consent. We also check for allergies, medication, and whether there is any need for blood transfusion. Proper site making is also ensured. Next is time out, which is done just before the procedure starts. The team introduce themselves, reconfirm the patient and procedure, and discuss the surgical, nursing, and anesthesia plans. We also make sure that antibiotic and any pre-medication have been given. Finally, sign out is done before the patient leaves the operating room. The procedure is recorded and all the instruments, needles, and sponge are counted. Equipment is checked and the team discusses the post-operative recovery plan. This process helps ensure patients' safety and reduce the risk of errors.
Furthermore, the importance of surgical count is done to make sure all the instruments and items are properly counted for during the procedure. This includes sponge, needle, instrument, plate, and suture. The count is performed together by the scrub nurse and the circulating nurse. This is done before the surgery begins. Before the wound closes, and again at the end of the procedure, both nurses must clearly confirm that the count is correct. If there is any mismatch, a recount is done immediately, and the surgeon must be informed. The surgery should not be complete until the count is correct, as this is essential for patient safety. In addition, the special instrument used in an open abdomen hysterectomy. A hysterectomy set is prepared for the procedure. One important instrument is the blepharoretractor, which is used to hold abdominal wall open and provide better exposure of the surgical area. Another key instrument is the golden hysterectomy clamp, also known as the Z-class clamp. It is used to clamp the uterus and help control bleeding during the procedure. The instruments are important to ensure the surgery is performed safely and effectively. The intraoperative consideration for open total abdominal hysterectomy. First, in terms of the special technique, the surgeon must perform carefully dissection of tissue and apply proper clamping of the uterus, vessel, and ligament. Ligation and cauterization are used to control bleeding, while strict aseptic technique is maintained throughout the procedure. Next are the specific responsible of the surgical team. The surgeon performs the operation and removes the uterus precisely. The scrub nurse prepares a pus insurance, maintaining sterility, and performs surgical count. The circulating nurse manage the operation room environment, document equipment. The anesthetist monitor vital signs, maintain anesthesia, and ensure the patient remains stable. Finally, this procedure is closely linked to the anatomy and physiology. The uterus is located near important structures such as the bladder, ureter, ovary, and major blood vessels. A good understanding of pelvic anatomy helps prevent injury, while knowledge of physiology is important in managing blood loss, fluid balance, and oxygenation. Aseptic technique concerned during surgery. It is important to recognize and avoid any risk in the environment that may increase the chance of infection. These include maintaining a clean and controlled surgical file at all times. Hand hygiene must be performed frequently, especially a key moment during patient care. Proper glove use also important, where sterile or clean gloves are selected based on the procedure and the need to touch key area. However, this is important to remember that wearing gloves does not replace hand hygiene. Maintaining good aseptic technique is essential to prevent infection and ensure patient safety. Lastly, for my part, surgical wound dressing. Surgical wound dressing is important to prevent infection and support the healing process. A sterile dressing helps keep the wound clean and dry while it heals, and it also absorbs any blood or fluid from the wound. There are two main of dressing. The primary dressing is placed directly on the wound. The secondary dressing is used to secure the primary dressing and keep it in the place. Proper wound dressing is essential to promote healing and ensure patient safety.
Next, I will explain about post-operative care, which focus on support and pain management after surgery. For support, after surgery, some patients feel anxious, emotional, or worried about their recovery. We should encourage patients to express their feelings and ask questions freely. This helps the patient feel more comfortable and less stressed. We should also reassure the patient that feeling anxious or sad after surgery is normal, because the body and emotion are still recovery after the procedure. Besides that, family members or support system should be involved, because emotional support from loved one can help the patient feel calmer and more motivated during recovery. Clear instructions should be given to the patient, such as how to care for the wound, take medication, and attend follow-up appointments. This can increase the patient's confidence in managing their recovery at home. Next is pain management. After surgery, patients usually experience pain, especially during the first few days. Therefore, patients should be informed that some pain is normal after surgery, so they will not feel too frightened or anxious. As ORA, we should also encourage early movement, such as sitting up or walking slowly, because they can improve blood circulation and reduce the risk of post-operative complications like blood clots or pneumonia. In addition, deep breathing and relaxation technique can help reduce discomfort and make the patient feel more relaxed. Patients should also be reminded to take pain medication on time and not wait until the pain becomes severe, because severe pain can be harder to control. Lastly, patients must inform healthcare staff if the pain does not improve or becomes worse, as this may indicate complication or the need for further treatment.
Hi, so how did all of you get it? So in conclusion, to wrap up my presentation, open total abdominal hysterectomy or TAH is a common surgery that can really help women who are dealing with ongoing gynecological problems that affect their daily life. Is it usually done when other treatments are no longer working, or when the patient and doctor decide that is the best option for her? Before the surgery, careful checks and proper preparation are carried out to make sure everything goes and often feel much better as their symptoms improve. Overall, TAH continues to be an important and effective treatment in women's healthcare. That's all from me. Bye. Thank you for listening.